Hello again, everyone, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me is Dr. Stephen Mazer, board-certified orthopedic surgeon specializing in surgery of the hand, also serves as Vice President of Medical Affairs for Monument Health. Welcome back, Dr. Mazer. Thank you very much for joining me.
Thanks for having me, Mark.
Let's talk about our hands today, right?
Perfect.
You are an orthopedic hand surgeon. How did this come about for you, Doctor, when you were in medical school and you thought, yep, I'm going to work on the one part of the body that's probably damaged the most?
Fair enough. You know, I just like the mechanical nature of it. I like the idea that you have a tendon that bends a finger and you pull on it, and like I can think about that. I can conceptualize it. I also like to do fine detail work. That's important to me. So if I'm doing a nerve repair or something like that under a microscope, it fits the personality.
Okay.
Like to work on little things and spend a lot of time on the details.
So did you have family members that were in medicine? Is that when you decided your profession, what influenced that?
Sure. So my father's brother, my Uncle Dick, is a hand specialist in California, a plastic surgeon who specialized in surgery of the hand. And so I knew there was such a field. And I was glad to be able to go into it. Since then, his son also became a hand specialist. So my cousin Ben also does hand surgery.
Are they in California as well?
Yep.
So you got the hand models out there that are really worried about how everything looks, and that's what they're fixing?
That's right. They're plastic surgeons. Yeah. That's right. It's all about the appearance.
Well, let's talk about just your hand in general and the injuries that can come from it. I know, and I feel so dumb for not knowing this much longer ago. But I don't think you think a lot about that. Your fingers above, I don't know, what part of your hand, maybe above the top palm, there's no muscle in there, in your fingers at all. It's just bone and tendon, and that's it. So you can't, people that work out their fingers, you're not doing anything, right?
That's well, you are.
To make the tendons, I don't know, better? Can you make the tendons stronger in a sense?
There's probably nothing you're going to do to make your tendon stronger.
Right.
Yeah, that's a good point.
What are the tendons then, and what do they do in your hands, Doctor?
Yeah. So a tendon is just an extension of a muscle. Okay?
Oh.
So we have muscle, and the muscle is in our forearm. Okay?
Right.
So I'm going to talk first about what we call the flexor tendons, the ones that bend your fingers.
Right.
Okay? So you have a muscle in your forearm, and that muscle then coalesces or comes together, okay, and forms a tendon. Okay, so the tendon is part of the muscle, okay, and then the tendon goes and inserts on the bone. Let me show you on the back of your hand.
Yeah.
Okay, so we have a muscle on the back of our forearm.
Right.
Okay, and then it coalesces into a tendon, and the tendon looks kind of like a rubber band. All right, so it's got these fibers that come, they're right next to each other, and they look like a rubber band. If you place your hand flat and you raise your thumb, okay, you'll see a tendon will pop out on the back. Looks like a violin string almost. Okay?
Yeah.
And you can play it, and it's firm, and it's very hard, and it's what's moving your thumb backwards. Okay? You can many times feel them on the back of your hand. Okay? The reason you can't feel them on the palm side of your hand is because they're held down to the bone by pulleys, but that's a different conversation.
Right.
Okay? So the tendon starts in the muscle, goes through the hand as a tendon, and inserts or fixes into a bone. Think of a rope, okay? If you have a rope and you put the rope into the wall, okay, and then you pull on the rope, well, the wall is going to move some. In fact, if you pull hard enough on the rope, what happens is one of two things. Either the rope breaks or it pulls a piece of wall out, right? Well, when that happens in your finger, we call that a mallet finger.
So we're going to talk about some of the common injuries, and that's a great place to start. Now the tendons, they're held onto the bone by those pulleys, or are they also attached in a different way?
Yeah, so sometimes they're held down to the bone, but pulleys on the palm side.
Okay.
But for the most part, what happens is they're just inserted into the bone. Okay. They have a very strong insertion into the bone.
Okay.
Right.
So let's start with that mallet finger that you mentioned.
Sure.
And how does it occur?
Sure. And so what happens is we have the muscle becomes a tendon, goes out to your fingertip, okay? And that's what lets you straighten your finger. It's what we call an extensor tendon. You extend your fingers, Okay, you can straighten them. Okay, and the tendon fixes into the bone. All right. Well, that tendon, when it gets out there to the bone, is really very, very thin at that part. Okay, and sometimes it'll break. Sometimes it breaks by pulling your sock up or pushing in the mattress. It doesn't take much sometimes. Or if you fall on it, you can imagine how if you fall on your finger and all of a sudden you flex it down, that tendon may pull off. Okay?
Right.
Using my rope into the wall analogy, if the rope breaks, it's just the tendon that pulls apart. But if it takes some of the wall with it, it actually takes some of the bone back there with it. Okay? And since the tendon is responsible for straightening the finger, when the tendon ruptures or pulls apart or pulls off of the bone, the finger actually droops. And you end up with a drooped finger. And so a patient will come in and they'll say, hey, I fell or I was pushing in my mattress, and gee, doc, I can't straighten my finger. I can push it straight. It won't hold. It won't stay there.
I'm trying to think of all the times I've done stuff like that to my hands. And that just, it must be the luck of the draw for some people then. Because the way you describe it, it seems like something like that would happen frequently.
It doesn't. It really doesn't.
Really?
But,
Okay.
But, as the hand specialist, we see a lot of these sorts of
Yeah,
things.
I suppose.
It's a very common problem that we see.
So then how is that treated?
Yeah. So you would think that we would need to operate on that tendon to put it back into the bone, but we actually don't. The great majority of the time, all we have to do is splint that finger in the right position and hold it there long enough to allow that tendon to heal.
Even if it takes off part of the bone, like you said,
Even
too?
if it takes off part of the bone. So it's got to really be pretty severe for us to want to recommend an operation for that.
So that's a rare thing then for a mallet finger.
It is.
Okay.
It is. Because the tendon itself, although it pulls off, is really held in place by a lot of other parts to the tendon. And so what we'll do is we'll use a small splint on the back of your finger, really allow the rest of your finger to move, and you have to wear it. But you have to wear it all the time. And it's a long time. It's probably 6 to 8 weeks or longer.
Okay.
Okay? And you have to hold it straight. So you put the finger straight, brings the tendon ends back together, okay? And you hold it there, okay? And you have to wear this all the time. So keep it dry in the shower.
Yep.
If it accidentally gets wet, you put your finger on the table so you don't allow it to bend, because every time you take the splint off and allow it to droop, you've disrupted that healing.
Oh,
and if you
okay.
do it enough, it just won't heal.
Okay. And then you're just back to square one and you got to start all over again. So just do it
Exactly.
right the first time.
Exactly. and really, you want to come in and see somebody.
Yes.
You want to get an X-ray. You want to make sure that if it did injure the bone, it's not so severe that you do need something else done. And then they can get you through the appropriate splinting routine. It's not as intuitive as you would think.
So again, if you're noticing your finger has that droop at the end, right? You're at that first joint, right?
Right.
Then that's what you want to come in and
Exactly.
And that probably is a mallet finger.
Okay. Most of the time it is. If it's an all of a sudden thing,
Right.
If you have arthritis and over time it just droops, that's a different condition.
Okay. All right. Let's move on to the boutonniere deformity. I don't like any part of those two words together for some odd reason. I don't like the word deformity. Maybe
Right.
that's what it is. Okay. What is that?
So a boutonniere deformity is when you get a pull where the tendon pulls apart, but it pulls apart not at the end like it does on a mallet finger, but over this middle joint.
Okay.
And what happens is, and it's usually from an injury. So you've fallen and you've somehow landed in such a way that you've torn this part of the tendon. Okay.
So yeah, that's on the top of your finger.
On the top of
Right.
your finger,
Yep,
on the
okay.
back of your finger, the top of your finger. And so what happens is the tendon there, you have a main central part, but then you have two parts on the side, one on each side
Okay.
that comes in. And so if you tear the piece on top, what happens is the two on the side come down and the joint itself goes through the tendon. It buttonholes through the tendon, almost like you stuck something through the buttonhole of your shirt.
Right.
Okay. And the joint gets almost stuck through there. Okay. And they end up with a deformity where the joint is permanently bent and the fingertip tends to bend backwards. So that's it's hard to use your finger if it's stuck or locked in that position.
That seems kind of similar to trigger finger. I mean, just from the way your finger is locked, right? So, sort of. Okay. But then, what's the procedure used to fix that? That just seems like that would be really painful if anything pushes up through that knuckle like that.
It can be painful. Most of the time, the problem is just that you can't straighten your finger.
Okay.
Okay. And again, the treatment for that tends to be a splint.
Okay.
Okay. So again, you'll come in. A lot of times, we'll send you to the hand therapist to have a splint made that's going to support that middle joint fully straight and allow you to bend the tip of your finger. And again, it's probably 6 to 8 weeks in that splint. And most of the time, you'll get it a lot better. You may not get it 100% better.
But that's more injury related, you would say, than like genetically or anything like that would happen, or even age, or
so that is more injury related.
Okay.
You can get it in certain other deformities. Rheumatoid arthritis is a common one, where if you get rheumatoid arthritis, you get inflammation of the joint, and that can cause the tendon to stretch and can cause a similar pattern.
So when should somebody see you for something like that? When they realize that their finger can't be straightened out?
And most of the time somebody's going to come in because they're going to fall and they're going to be like, hey, my finger doesn't work.
Right.
You know, every time I bend it, I can't get it straight unless I force it straight. And it tends to be pretty painful. So
man.
People are going to come in for that.
Okay. Let's move on to the Jersey finger. Doctor.
Yeah. So this is names. Not named after New Jersey.
Okay. That was going to be my obvious first question. Sure.
So a Jersey finger is classically described as you're playing football. Right? Okay. So you're playing football and you grab another player's jersey. Okay, and that other player is stronger than you and pulls away. Okay, and so you're using your flexor tendons to bend the fingers, and they're pulling away. Okay, and what happens is they pull until the tendon that bends your finger literally pulls right off the bone.
Jeez.
Okay, and so we call that a Jersey finger.
I suppose that can happen on more than one finger then too.
It can. Interestingly enough, it's most common on the ring finger, and it has to do with how the tendons are attached in the forearm and their relative length. So it's almost always the ring finger.
Okay. So then what happens when that tendon tears off in that finger?
Yeah. So what happens when the tendon tears off is you lose the ability to bend the fingertip. Okay. You actually have two tendons that bend each of your fingers. So you have one, which we call the flexor digitorum superficialis tendon. It's got a long name.
Love it.
That goes into that middle bone there, and that allows you to bend that second joint. So that one is still working. Okay, but the flexor digitorum profundus tendon, which is the one that goes into the fingertip, is the one that's disrupted, and so you lose the ability to bend that fingertip. Okay, and so if you do nothing for it, when you go to make a fist, that ring finger is going to stick out.
Sticks out.
Okay,
all right.
And so really the treatment for that is surgical, because the flexor tendons are more like rubber bands, and they're going to tend to retract back into the hand. So if this thing pulls off, it's not like you can do a little surgery out there at the tip and just put it back in. You really have to open up the whole finger. You have to find the end of the tendon because it's retracted or sprung back.
Well, aren't you going to notice that when that happened? Wouldn't you notice the tendons coming down here?
No, you don't.
Really?
Yeah, those tendons are really pretty deep because you're right. There's no muscle in the fingers,
right?
But there's nerve and there's blood vessel and there's other soft tissues there, and you're not going to see the tendon snap back.
Oh, okay.
You'll have felt it.
Yeah.
You'll be like, oh my God, that really hurt. It's going to turn nice and black and blue for you. And you're just going to notice that, gee, it hurts to bend my finger, and gee, the tip won't bend.
So then that's a surgery.
Yeah, that's a surgery. Or you can live with it, because for some people, they just like, okay, fine, I don't bend the tip of my finger.
Well, you're just going to look dumb in a fight is all I'm saying there, right?
That's right.
All right, let's just talk about, injuries to your hands kind of in general. They've got to be one of the most cut areas of your body, I would assume, too.
Yeah.
Most of us, we get a cut, you put a Band-Aid on it, you're fine. If it's a little deeper, you might think, maybe a stitch, right? But how do you know when you've cut your hand if you've done significant damage, say, to a tendon?
Sure.
How would you know that?
So here's where I'm going to advise, if you've cut your hand, you really do want to get this looked at.
Really?
Yeah.
Okay.
Yeah.
No matter what. I mean, if it's deep.
I mean, if it's deep, that's right. I mean, look, if you've got something superficial and you know that it didn't go into the deeper structures,
right,
that's fine. But anything that's got any depth at all, you really want to be evaluated, because the tendons are very, very close to the skin, particularly on the back of the finger, and even on the palm side, we're talking a millimeter or two. And imagine if again, we're going to use our rubber band example, okay? So let's say you're using a knife and accidentally the knife goes in. Frozen hamburger trick, right? Mm-hmm. You're trying to cut, you got 2 frozen hamburgers, okay, in your hand, right? And what do people do? They take a knife, right?
Wedge it in
and
there.
And they're like, I'm going to separate that, and boom, goes through, okay? You get this little tiny nothing puncture.
Right.
Right? Okay, so right underneath the skin there, right, are the tendons. And the tendons are like a rubber band. So imagine if you cut 80% of a rubber band. At first, rubber band works, okay? A couple of days later, you're working the rubber band pops, okay? Much easier to fix the rubber band when it's partially cut than when it's completely cut. And there's no way you're going to see that tendon or that rubber band in the cut. Okay, so you really do want to go to an emergency room, urgent care, where they can take a look at it, wash it out, because that knife gets down deep, and if there's bacteria on that knife, it'll tend to what we call seed or put bacteria into the deeper tissue. So infection risk is very high, particularly in the hand. Okay, and you want somebody who knows how to examine the tendons and the nerves. You don't want to just say, hey, I can move my fingers. There's some specific ways we have to examine the fingers to determine whether or not a tendon has been partially or completely lacerated or cut. That's not going to be inherently obvious to a patient.
Right. Oh, that's...
So please go in.
Yeah. I didn't realize they were so close to the surface, I guess. But, I mean, I suppose you can just touch the back of your fingers. I mean, it's not like there's a lot of meat or muscle or things in there.
Not much there.
And so, if you cut it, then there's a real good chance you're hitting that tendon.
That's exactly right.
So after you get it looked at, I'm assuming rehabilitation kind of plays a role in some of this too with your tendons.
Yeah.
What does that look like?
So what's going to happen is, let's say you've cut your palm from frozen hamburger trick, okay,
right.
and you've got this cut, and you've went to the emergency room, and they said, hey, you really need to see the hand specialist, okay? We'll examine you, and if you've cut your tendon, we're going to want to take you to the operating room and repair that if you want to regain the function of your finger, okay? So we'll go in, we'll make that incision somewhat larger on your palm, okay, so that we can get to both ends. And remember, this tendon snaps back.
Yeah.
So if you cut it in your palm, that other end can be somewhere up in here, right? So we've got to find the 2 tendon ends and bring them together, okay? And then we sew that up. But we also talked about what holds the tendon down to the bone is these things called the pulleys. And if we just sew the tendon together, all right, and let it heal, put you in a cast, let's say, and let that heal, not only does the tendon heal to itself, so the tendon heals, but the tendon will heal to everything else in the neighborhood. Okay, so it'll get stuck to the pulleys, it'll get stuck to the skin, and when it heals, if we were to put you into a cast, it's not going to move well. In fact, years ago, when you cut your finger in that part of the finger and the tendon was lacerated, we didn't repair it at all because it just didn't work. We used to go back later and do what we call a tendon graft. Now we'll repair that tendon, and the difference is not so much how we suture the tendon together. The difference is really in the therapy protocols that have been developed by our hand therapy colleagues to allow those tendons to glide after surgery in such a way that they won't pull apart, but glide enough so that they don't heal to the surrounding tissues so much. And that's a long process.
Yeah.
If you've lacerated the tendon, the flexor tendon in your finger, you're looking at least 6 to 8 weeks of hand therapy and probably, 8 to 12 weeks until you're back to your activities.
Oh, wow. But it's obviously it's much better than going in and doing another surgery, I'm assuming, right? To have that therapy instead that can fix it, like you said, how it used to be to now.
That's exactly right.
Yeah, okay.
It works much better now, and it's really the advances that our hand therapy colleagues have made.
That's excellent. I want to wrap up this podcast with one other term, Doctor, that I thought was a euphemism for something else that happened. But it's a literal it's a literal statement. Avocado hand. When I saw that on the sheet, I thought, all right, this has to mean something with, like, my first thought went to cauliflower ear, right? So when you get your ear boxed enough, it looks like a cauliflower. Well, avocado hand, explain that, doctor. What is an avocado hand?
So again, you're holding an avocado in one hand. You use this coring tool to take the core out of the avocado. It's kind of a blunt tool. It's
Right.
not a nice sharp knife, right? And you get around the pit, and it slips, and it goes right into your hand, and it cuts whatever's in the way, be that tendon, be that nerve, whatever that is.
Is it really that common? Is this something you see?
It happens.
More.
It happens.
More than we should.
I won't say I see it every day.
Well, and you
it
have people
happens.
too that will take a giant knife and they'll try to hit the pit to pull it out, and you see people that miss, and that thing will go into your fingers and, like we said, hit the tendons, and the fact that that's a real thing. Well, that's just a great way to end this, I guess. Dr. Stephen Mazur, board-certified orthopedic surgeon specializing in surgery of the hand. You're also the vice president of medical affairs for Monument Health, too. Anytime you've got some more hand terminology specifically you want to talk about, let's do this again, doctor, okay?
Wonderful.
Thank you
Thanks so
very
much.
much. You bet.